is the subject of my biomechanical analysis. I will discuss the origin of its inception, the key variables within the motor skill, discuss the movement occurring and the 3 techniques typically employed, talk about the content that me and my peers collected, a kinetic breakdown of the quantitative and qualitative variables. I'll then interpret the data and consider future changes, and then review the deterministic model and show some sources. The football throw has simply identifiable actions that take place. 2 hands must touch the ball, the feet must not enter the field of play, and the release is from behind the head. The FA, the governing body, last made changes to these rules in 2005. Despite the rules instructing an action, over time, player autonomy has led to different employment techniques, depending on the circumstance. Rule changes as a result of players like Ian Hutchinson, who in 1970 threw the ball overhands like a goalkeeper, in modern-day goalkeeper. Those rules had to be changed, as you'd throw the ball to the far side of the field where no one else was marking an open player, and they would score a goal, hence common rule changes. Here you can see a stop-motion capture of my participant, and F. Mora suggested that there are 5 identifiable stages of movement within this motor skill. Within the 5 stages of movement, the first one, the precognition stage, is the decision-making the player takes before the action starts. That is the largest phase, with the rest and the sum of the rest of the action only taking 2.21 seconds on average. The body parts used to throw is extensive, but differentiating and recognizing which limbs and muscle groups are working in sequence versus simultaneously is a valid consideration when coaching the athlete. Part practice is a coaching style, and part practicing the individual's limb movements may increase the competency and muscle memory for the athlete, whereas whole practice reduces the focus point of the athlete to externally focused and measuring the outcome through possession kept and not the technique employed. E. Kolath talked about the competency challenge point, discussing that 0.5 confidence or higher, but lower than 0.5 competence has a severe effect on the repeatability of identical methods. Prior research has shown 3 common throw types that are typically employed within a game. All 3 throws have pros and cons that I will discuss, but the employment are determined by the open player environment that is never the same within the field of play. So by better understanding the required situational awareness, players can better use the correct technique. Using Canovia, many metrics were identified and tracked. The standard velocity of the athlete's body in this example was 3.06 meters per second, and this was the standing throw approach. Many markers were placed on the participant on significant joints and lever points to track the change in displacement of angles, limbs, and objects. The run and drag technique can be seen from 2 different angles, giving a vertical and horizontal context and depth. More so, the foot placement and stride length and stride rate can be approximated, and then using the online technologies, we can determine the distance. The methodology for our tests were as follows. Free practice for a warm-up with no coaching input. Then there was a pre-screening for experience level, health, and competency. And then there was 1 minute of each activity. So 1 minute of throwing per attempt, and that's what was recorded. Within the deployment of these 3 techniques, there are 3 critical features worth analyzing, known as qualitative variables. So how is the body weight transferred using body manipulation? How is the body moving to support the outcome goal? And how do limbs advance to project an object? The measurable statistics that were tracked will be discussed later in the presentation, but trackable objectives were set to denote the posture and projection, the change of lever angles, and the summation of forces generated. Recognizing movement principles at play can broaden the depth of this investigation. Perception-action coupling encapsulates the coordination aspects between the visual inputs, space, time, and limb deployment. I like to refer to it as the monkey-see, monkey-do principle. Similar to Newton's laws of motion, an action has a reaction. This coupling is closely related. Motor performance is being tracked and assessed, and is defined as the ability of the neuromuscular system to perform a task. Motor learning is not being assessed, but is a key consideration for the inclusion of a second part of this investigation. One overarching fact that has been a thorn in my investigational analysis is the athlete performing has no understanding of a successful repetition in my research design. Being monitored was the motor performance and application of the intrinsic dynamics, briefly explained by a coach, but no apparent extrinsic outcome assessment tool was employed, which could affect the repeatability of attempts. And there was no real game situation for this to occur. There's no target teammate or defensive pressure, which opens a whole nest of variables that are too large to consider for this biomechanical analysis. Deterministic model. So it's the opposite of a random event occurring, and it underpins the Canovia analysis purpose. So using stats that are quantifiable and principles of movement that are that are qualitative, the deterministic model can best assess the viability of technique employment. As previously mentioned in the quantitative and qualitative data, it's non-representative of a real game due to the nature of the testing. The testing is repeatable and realistic procedure, but it does not match the intensity of a real game. The 3 R's are a key principle taught by Football Queensland and Football Australia: repeatability, realism, and relevance. Taught to coaches in the skill acquisition phase of learning for younger players aged 8 to 12, teaching core motor skills require repetitive practice and relevant application, but sacrifice of realism can promote the motor learning. Previously discussed already was the intrinsic dynamics of the athlete. I believe it's a key point of consideration for further investigations. Silvia Vinas of the Barcelona University alludes to decision-making influencing movement variability, which in context to this assessment is making the situation for the throw-in attempts more realistic of game scenarios, and that will increase the variety of techniques being used to reach the target. If we think about the perspective of the player, they are not thinking about the speed or the distance or the trajectory, they're just thinking of reaching the target. The advanced biomechanical concepts that underpin my quantitative data, deciding that the body velocity, the center of gravity of the participant, and the base of support is the foundation, and they are the most important to focus on. The inclusion criteria for attempts is they must visually pass the inspection test of looking like that particular technique. It must reflect the movement ranges, so there's a deletion of outliers. For example, if there is a poor standing attempt, the release angle must be within a certain range. On screen now is our data collection. As you can see, we've employed the apex height, which is the max height during the attempt. The width is the horizontal foot displacement and shoulder width apart. The drag is of the rear foot. The final step, the stride length, is the longest step, which is the final step before release. The height of the hip to ground at the release point. The load angle is the release point and the cock back of the load. The near leg was always the right leg and measured the stride angle from the ankle to the knee to the hip, and markers were used for this. During both release points and the highest apex angle during stride, the velocity was the mean per attempt type, the time was the mean per type, the stride rate was per second, and the stride distance was total. The mean values are in blue, the peak readings are in green, and the grey is the standard deviation between scores. Determining what is an ideal metric, I had to compare against Kolarth's journal article in Germany, Institutes of Sport, determining whether an angle meaning larger or smaller was better or worse. Here you can see a comparison of the throw-in techniques. The arms are represented by the load angle release and load angle back in degrees, and the legs are represented by the stride angle release and the stride angle apex. So how much your arms go back and release, or how much your legs stride out and open an angle before release. Now interpreting this data, if the load angle on the back is lower, the release point angle spreads larger, meaning a larger lever distance and a larger propulsion rate. During the standard throw of a single stride, it's lower in distance, but the participant is tallest at the apex of action. Therefore, it's lacking an effective weight transfer. During the run and stop, the kinetic energy and momentum of force generation is not transferred in unison, acting like a whip with the end point and tip moving a lot, but the handle remaining still. Based on the data collection tools and deterministic analysis can be employed to determine the best general characteristics of a football throw-in and what it must include, based upon the 3 R's of training integration from Football Australia. The run and drag ticks most of the boxes within the large summation of forces generated during each repetition. The muscles, joints, and levers of the body work in synchronicity to propel the ball forward, simultaneously. Simultaneous motor deployment with a smaller rate of wasted movement versus the other methods, proving it to be the most effective. In conclusion, the 2 most important quantitative variables are the intention versus outcome goal, which affects the stride length, and the load generation. Trying to release quickly will lower the release angle spectrum, and trying to release powerfully will increase the release angle spectrum. Now speaking about quantitative, the higher the velocity and momentum generated during the run-up equals the higher projection distance of the ball. The lower of the hip to ground during release, when elongated with the stride, increases the center of gravity reliability, and also increases the lever distance and promotes force generation. Considerations about the data collection methods could be further scrutinized in the second part of this biomechanical analysis. The resources used were the governing bodies, journal articles, and professional data analysts. This helped form the understanding of a logical method of practice, allowing my research interpretation to dictate which method passes the deterministic model the best. I believe that is the run and drag, who uses simultaneous movement to propel the ball better.